Kathy?
Yeah, I certainly agree with you. I think the flip side to that is one of transparency and making sure that the groups that you're working with really understand the risks of the drugs that they're about to take. And I mean, certainly in the world of HIV, people are dying. So if I have the choice of dying or taking a drug that might keep me alive, I'm going to take the drug because I'm going to die anyway. But I think there's got to be conversation, and again, it comes down to that collaborative piece with the community and with the drug makers to make sure that there is full disclosure and full transparency on what the risks are.
Yes, right here in front. Then we'll get to this young lady.
Stephen Sloan, Saks Equity. I first want to thank the organization for putting a great event together, not just here, but it sounds like elsewhere, and taking on what's an energizing task, but surely a daunting task. Clearly, there's no silver bullet to make this happen, and the panel, I think, all your comments tied together very nicely. A couple of just observations for consideration or comment is I don't think we should take for granted the progress on stem cell research, that perhaps now is the best time to engage in dialogue to try and help people realize it's going to happen, might as well happen here. And for those who are concerned about how it happens, this is the best place for it to happen because of the transparency. I also think in terms of education, I have a couple of kids. I think it's sad when music gets taken out of the curriculum, and I had to smile when the first family did something for classical music, not because I'm a very good musician, but because there's reams of research on how that helps develop the part of the brain that has, meaningful implications for science and math. So I'd like to see music in all the school systems again. And then lastly, the financial component, which maybe was represented, but because of the format at a superficial level. I think the global regulatory reform in the wake of the financial crisis needs to be monitored closely, and the decision makers should have the benefit of input from folks on this panel as to how their decisions could potentially impact innovation, in particular the AIFM legislation in Europe. So thank you very much.
Great, thank you. Anybody want to comment on any of that? Yeah, this young lady up here, and then we'll come back over here.
Hi, I'm Lisa Yorman with Action CF. I have 2 children with cystic fibrosis, and I have to say to Mr. Crowley, I commend you for taking the bull by the horns, and as I've learned...
Mostly by the horns, yeah. Sorry.
I've learned by the power of advocacy that diving in for change is what's necessary, and I myself have done it over the last 15 or so years, so again, I commend you for that, and I do have my first paragraph written in my book, so if anybody wants to write a movie or make a movie, it's okay. I actually, about 6 weeks ago, had the opportunity to attend a cystic fibrosis annual conference with about 2,000 scientists, and the first plenary was by Dr. Francis Collins, who studied the genome and found the genomes and everything. And one of the things that the Cystic Fibrosis Foundation had done was they created a therapeutics development foundation. And what Dr. Collins said during his speech, he said that he's going to take that into as director of the National Institutes of Health and take that model and bring it to other orphan diseases. And I thought that, with the 8 years of kind of stymied medical research, I thought that was an excellent start to making up for that time frame. So that's a comment. The other thing that brings close to home is I have 2 children that are gone through high school. One's in high school, one's in college, and education and funding of education at the lower grade levels. I'm also on the Board of Education in my town. We're at a point where we're teaching to the test. We're not teaching reading, we're not teaching writing, we're not teaching math. We're teaching to what's going to be on that exam when you graduate. And it's not the SATs and it's not the PSATs. It's not even the placement test when you get into college. I've lived through it with one of my kids that is attending Kane University locally in New Jersey, and my son who's in basic skills instruction math and has gone through the whole program and is now learning 8th grade skills in 11th grade so he can pass the test. So he can't take orchestra or band if he wanted to because he has to be able to pass the test. So there's not the growth of education in sciences and in math that were there 30 years ago. And I'm disappointed in that. Now my question would be, there's 2 questions. One is, how do you take it from a public-private partnership and bring that science that you're not learning within school, not the kids that are in AP, we're talking about the kids that are in the CP level and lower. So how could you take that into public-private partnership? And then also, what is your feeling regarding Dr. Collins' implementation of the therapeutics development program?
John?
I'll be happy to take the last part of that. Dr. Collins has been just remarkable in his vision for how he's going to transform part of the NIH. And the CF Foundation has really been at the cutting edge. And for years, the CF Foundation had raised money and given it to basic research, very important work and strong results. But over the last decade or so with this therapeutics initiative, they've taken tens, it may even be hundreds of millions of dollars now, given to industry and partnered with industry very, very proactively. In fact, here in New Jersey, there's a company called PTC Therapeutics that I'm sure you know well, that is maybe all of 10 years old. It has some really advanced technologies now in phase 3 clinical development. Its lead programs for this new application of a technology based on the understanding of human genetics is in muscular dystrophy and cystic fibrosis. Much of that work, it was initially funded by venture capitalists, industry partners. A lot of that translational clinical medicine has been funded through private foundations, including the CF Foundation. So that's a terrific example of filling in that gap. And I think what Francis is trying to do is to take that model now to the NIH and broaden out the area that the NIH can play in. And I think that will be instrumental, particularly in the rare disease field, where it is still difficult to get industry to work in these very, very unique disorders. So.